Hi, everybody. This is Dr. Brett Talley, Daniel, MD, with my ninth podcast for the migraine part. And I'll be talking today about, does Botox work for chronic migraine? All right. Onabotulinum toxin A, or as it is colloquially known in the world as Botox, is a famous dermatology beauty-assisting facial line erasing drug, which also works for chronic migraine headache and has an indication from the FDA for migraine prevention for patients with chronic migraine, which is 15 headache days a month, 8 of which have migraine features. And migraine features are a severe headache on a scale of 1 to 10, migraines over 5 and can go to 10. The headache lasts from 4 to 72 hours. They're usually one-sided and may be throbbing or pulsating in nature, and associated with nausea, vomiting, and sensitivity to odors, light, and sound. Botox has not been found to work for episodic migraine, which is defined as less than 14 headache days a month, or for tension-type headache, which is really the most common type of headache. So, Botox is a neurotoxic protein produced by the bacterium Clostridium botulinum, and it prevents the release of the neurotransmitter acetylcholine at the neuromuscular junction. This can result in paralysis of striated muscle, which is found in eye muscles, the diaphragm, arms, and legs. Human infection with the bacterium causes the disease botulism, and it's marketed in the United States as Botox, used commercially in medicine and cosmetics. So the question is, does Botox work for chronic migraine? Yes. Botox received FDA approval for treatment of chronic migraine on October the 15th, 2010. The toxin is injected into the neck and head to treat chronic migraine. Approval followed evidence presented to the FDA from 2 studies funded by Allergan, that's the pharmaceutical company who makes Botox, showing a very slight improvement in incidence of chronic migraine for migraine sufferers undergoing Botox treatment. Botox significantly reduced the number of headache days per 28-day cycle relative to placebo at week 24. Placebo means sugar water, or something that's given to a patient but really doesn't have any treatment effect. So Botox decreased headaches 8.4 days versus placebo reduced headache 6.6%. So Botox improved health-related quality of life and had an acceptable safety profile. Related questions. What's the dose of Botox for chronic migraine? Well, the chronic migraine dose is a total of 155 units intramuscularly divided into 31 sites and given every 12 weeks. So it comes in a bottle, uses a syringe with a small needle. And Botox dosing for chronic migraine, I'm just going to tell you a little bit of this. You can go to my webpage and read my article on this subject and see all this written down. But for the frontalis muscle, which is the forehead, that's 20 units and 4 sites. The corrugator muscle has 2 sites where you inject. Occipitalis muscle has 30 units and 6 sites, and so on like that. So that's all written down. It's really not important for patients. The doctor does the injection. He has to know that. What is botulism? Botulism is an extremely rare disorder which may cause limb and breathing paralysis, sometimes resulting in death. Botulinum toxin is a potential biologic weapon, so the U.S. military is interested in finding an antitoxin or blocking molecule to protect soldiers who have been given this toxic protein. The exact structure of the link between the toxin and the nerve cell is now known, which will hopefully make it easier to find this blocking molecule. It is said that 1 gram of botulinum toxin could kill over 1 million people, whereas 2 kilograms could kill the entire human population on Earth. So we're talking about a really severe military-level poison. Botulinum toxin acts on the neuromuscular junction to cause muscle paralysis by inhibiting the release of acetylcholine from the presynaptic motor neurons. And botulinum toxins act at 4 different sites in the body. They work at the neuromuscular junction. That's the junction between the nerve and the muscle. It works in autonomic ganglia. It works in postganglionic parasympathetic nerve endings and in postganglionic sympathetic nerve endings. Botulinum toxin induces weakness of these muscles by inhibiting transmission of alpha motor neurons at the neuromuscular junction. This led to its use in conditions with muscular overactivity, such as dystonia. That's a neurologic condition where people have abnormal contraction of limbs through the muscles. You can inject the muscles, and the movement, unusual position of the muscle is corrected for a period of time. Transmission is also inhibited at the gamma neurons in muscle spindles, which may alter reflex overactivity. The toxin also inhibits release of acetylcholine in all parasympathetic and cholinergic postganglionic sympathetic neurons. This fact has generated interest in its use as a treatment for overactive smooth muscles, such, for example, in achalasia, where people have trouble with acid production in their stomach or abnormal activity of glands, for example, hyperhidrosis, which is oversweating, and some people sweat like crazy underneath their arms and soil their shirts, and so they'd like some treatment for that, and you can give injections underneath the arm to do that. Botulinum toxin requires 24 to 72 hours to disrupt the nerve-muscle process. In very rare circumstances, some individual require as many as 5 days for the full effect to be observed, peaking in about 10 days. And the effect of this toxin lasts about 8 to 12 weeks before it's metabolized out of the body. How does it work? Well, Botox is botulinum toxin, a neurotoxin produced by the bacteria that cause botulism. The toxin is purified and used in tiny doses in specific areas to block motor muscle contraction. It wears off after about 3 months. It's common knowledge that plastic surgeons in Hollywood inject movie stars with Botox. In that circumstance, the toxin paralyzes the facial muscles and eliminates frowns and facial lines. It has been known that Botox toxin would block efferent, that means motor nerve transmission, but how it helped migraine has not been understood. Recent articles have discussed that Botox will block the release of a common neurotoxin generated during the migraine process, which is CGRP, and this helps migraine. The migraine process releases 3 neurotoxins, and that's one of them. What do Botox injections feel like? Patients describe the injections as like tiny pinpricks as the needle is going a shallow distance into the muscles in the face, jaw, and back of the head. The drug works best if given in the protocol as described above. Sometimes no migraine relief works on the first try, so it's recommended a second trial be given before giving up. What are the side effects of Botox? Well, there may be problems swallowing, speaking, or breathing, which sound pretty bad and you wouldn't want. The toxin effects may appear in areas away from the injection site and may cause all-over muscle weakness like double vision, blurred vision, drooped eyelids, hoarseness, change or loss of voice, or unclear speech. Again, these are temporary symptoms and they should go away in 3 months. On my blog, I have a picture of a woman with a droopy eyelid, which is called ptosis, related to Botox injection. What does Botox cost? Well, most insurance companies will cover the Botox therapy, most of it. Patients should talk to an insurance supervisor about coverage, but I would stress the patient has to have a clinical evidence and documented story of chronic migraine, which again is 15 headache days a month, 8 of which have migraine features. What's the effectiveness of Botox? Allergan, the maker of Botox, says that some patients in company-sponsored trials experienced a 50% reduction or more in headache days per month after 2 cycles of Botox, and that more than 2 out of 3 patients showed some improvement. Nobody else has achieved these same results. An April 24, 2012 article in the Journal of the American Medical Association headlined that Botox injections are only modestly effective for preventing migraines in the most frequent sufferers. The researchers looked at 27 trials comparing Botox to placebo and 4 other studies comparing Botox to other migraine treatments. Botox treatment given to patients with chronic migraine prevented 1.8 headaches a month more than placebo. The researchers who wrote this article in the AMA Journal in 2012 felt that Botox was, quote, no more effective than commonly used preventive migraine drugs. It didn't work for chronic tension headache nor for patients with episodic migraines. There is also a high placebo response with Botox use. Dr. Nijar, MD, is headache specialist at Johns Hopkins University School of Medicine, said, quote, the research analysis will surprise few clinicians working in the field. This review emphasizes that most patients experience modest benefits, but we already knew that, he said. What are other problems using Botox for chronic migraine? 80 to 90% of patients with chronic migraine are overtreating with over-the-counter analgesics like caffeine, opiates, Advil, Tylenol, caffeine, or butalbital, and that causes chronic migraine due to medication-induced headache. This syndrome used to be called rebound headache. Please see my articles at drmigraine.com in categories on medication-induced headache. When I see these patients for second opinion, they're already on Botox, but they're not doing well. I discovered they've never been educated regarding how taking too much headache medicine can cause headache. That's the first thing I do with these patients is educate them and try to get them off their headache medicine that they're taking. The International Classification of Headache criteria for medication-overuse headache are taking a triptan. Those are the best drugs for treating migraine now, like drugs like Imitrex, Relpax, and things like that, are ergotamine, taking a triptan or ergotamine more than 10 days a month, or taking a non-opiate simple analgesic like Tylenol, caffeine, or Advil more than 15 days a month, or an opiate narcotic like hydrocodone or analgesic combined with barbiturate like Fiorinol more than 10 days a month. I saw a recent patient who was getting Botox, was taking hydrocodone from the same doctor. That's really bad medicine. In my opinion, patients should be educated about medication-induced headache and detox before Botox is ever considered. Most of these patients pass right on into the episodic headache and do well. So I'll close with a statement here, the general statement I give to patients. For good migraine treatment, do the migraine lifestyle, which includes exercise and good sleep. Don't take caffeine. Eat 3 meals a day, exercise aerobically 34 days a week for 20-30 minutes. Set your sleep cycle to be the same. Don't nap or oversleep too long. Deal with stress and don't overtreat with over-the-counter drugs like NSAIDs, caffeine, or triptans more than 2 days a week. And don't ever use opiate narcotics or butalbital at all for chronic headache. Consider getting on a migraine preventive drug. For chronic or episodic migraine, the new CGRP drugs have been approved and really working well. Those drugs are Aimovig, Ajovy, or Emgality. Limit all headache medication to no more than 2 days a week, except maybe DHE or Timolol eye drops. Again, don't take opiate narcotics or butalbital. As far as I know, there are no drugs comparing Botox with the new CGRP drugs. So that's the end of this talk. Good luck to you all, headache patients. God bless you. Hope you do well. I'll see you again on the next talk. Bye-bye.